In Together for Health, Welsh Government set out the challenges that we face. Our population is ageing. There are more and more older people because people are living longer. But unfortunately, the health of the population has not improved as much for some as for others. Here in ABMU, those people living in the most well-off areas have up to 23 years of more life without illness than people living in the poorer areas, and we think that that isn't acceptable. The health of the population has improved over the years, but it hasn't improved as fast in Wales as it has in some other countries. In ABMU we have a particular problem recruiting some groups of staff, particularly some types of doctor. These problems are not unique to us and in fact extend across the United Kingdom. We have problems recruiting children's doctors, obstetricians who deliver babies, some psychiatrists, and doctors who work in the casualty or accident and emergency unit. These are in really short supply. This means that we often don't have the right number of staff, and that sometimes means our services are not as safe as we would like them to be. We know that the quality of care in the NHS has improved, but it hasn't improved as much as it could, and we think there's a lot more we could do. The expectations on the NHS have gone up. Both politicians and the public expect more from their NHS, and we think this is reasonable, but it does place a lot of demands upon the service. The NHS is not immune from the world economic crisis. We know that here in NHS Wales, the amount of money that we will have to spend each year is staying the same for the next few years. But of course there is inflation, rising fuel bills, and some pay rises for some of the lower paid staff. And so effectively, we have less money to spend each year in real terms for the next 3 or 4 years at least. So we have to make our money go further if we're going to be able to deliver services that are as good or even better than now.